Welcome to Orange County Chiropractic Car Injury Clinics, and let me share with you how to not only get out of pain, but most importantly is how to decrease the likelihood of having a permanent injury the rest of your life. And let me share with you how that works. When you're in a car injury or any type of major injury, what happens is your body heals in three phases. There's the inflammation phase, there's the repair phase, and there's the remodel phase. Now, there's good news and bad news about this. The good news is we have very specific therapies to not only help you feel better, increase your mobility and range of motion, but also decrease the likelihood of you having permanent injury. Now, the bad news is when you don't receive very specific therapies within each of the different three phases of healing, that is the highest likelihood of why you will have a permanent injury to some degree the rest of your life. And let me share with you how that works. So when your body's going through the inflammation phase, the goal of the therapy is to decrease pain, muscle spasms, inflammation. That's the goal. So we use our therapeutic protocol to do that. Very specific therapies that help that. Now when your body is in the repair phase, there's about 5 factors that happen. Your body produces nerves in those areas, those regenerative nerves, and they're typically more sensitive. Now, what does that mean to you as the patient if you heal wrong with those nerves being more sensitive? Well, what it means is when you do normal activities of daily living that you had no trouble before, then you'll have pain when you do it. Now, again, that's if it heals wrong. And we can heal wrong. It happens all the time. Matter of fact, it happens frequently when you don't get the right therapy in the right phase of healing. That's probably the most common cause of permanent problems, to be honest with you. So the next thing that happens is there's an increase in the number of those nerves. When you have damaged, inflamed area, whether it's your neck or your back, there's what's called an increase in the number of nerves. Well, the bad news about that is if you have an increase in the number of nerves in a particular area and you move in your normal, motions that you did day to day with your activities of daily living, your normal activities will cause pain just because there's an increase in the number of nerves that can be compressed or fired. That's not good. That's a source of pain. Another source of potential pain is those nerve endings can get trapped in the scar tissue. Scar tissue is laid down to try to heal. That's what tries to get your body to heal after you have inflammation and lesions, things like that. Well, what happens is the scar tissue goes in there, or the nerves go into that scar tissue, and they can heal wrong. In other words, what happens is it's kind of like the scar tissue lays down kind of like a matrix, and those nerves go in there and they kind of get tangled. And then when you move, that matrix pulls, and if there's nerve endings within that scar tissue, when you move, it compresses those highly sensitive nerves. That's it. By the matter of fact, what I just shared with you is the number one cause of failed surgery. Is after the surgeries turn out good, but it's the scar tissue it's the nerves that get tangled in the scar tissue that continue the back pain. Not that there was a bad surgery. So there's therapy that specifically limits and prevents that from happening. And then, so then you have the scar tissue. It's weaker now because it's disoriented. And what does that mean to you, the patient? Well, if it heals weaker, then you're more susceptible to re-injury. And that scar tissue is only 30% or 70% is elastic. What does that mean? Means if it heals and it's only 70% elastic, it means when you move, you're going to start, and when it heals permanently wrong, it means you'll be stiff. That's what happens. And typically what happens is when people heal wrong from injuries, they have stiffness, lack of mobility, kind of at the end of whatever motion is injured, whether it's bending forward, backward, left, or right. That's what happens when you heal wrong. And healing wrong occurs from not getting the right therapy through each of the three phases of healing. And so typically you'll have restrictions and pain and actually re-injure. That's typically what happens when you heal wrong. Now, what stops that or prevents it or limits it is in the inflammation phase is, like I said, we use the therapies to help decrease muscle spasms, pain, inflammation. But that has to switch. When the body starts going into what's called the repair phase, the therapy has to switch and or include physical medicine, chiropractic physical medicine. The reason I say chiropractic is, number one, you have to have physical medicine to align the collagen. Only physical medicine does that. And only chiropractic treats all three ranges of motion, active, passive, and joint motion. That's what it does. That's what it does. That's why it's so effective when you actually get chiropractic treatment in the repair phase. It helps to align the collagen, which prevents the nerves from getting trapped. It helps to increase, when the collagen or the scar tissue is aligned, it helps increase the strength. It also helps increase the elasticity or the mobility, preventing that area from being stiff and rigid. And because the nerves don't get trapped and they're not as sensitive, you don't have pain. That's why physical medicine is so important in what's called the repair phase of healing. Now, and I'll just share with you this from experience. One of the common mistakes that we typically see is when patients go through these three phases, and in the middle phase, the repair phase, they only take medicine. They don't get any physical medicine at all. They only take medication. And that's what I found and what we found to be one of the leading causes that lead to permanent problems, is not having physical medicine to affect the nerve sensitivity and the collagen in the repair phase. Now, in the remodel phase of healing, remember, if your body doesn't receive some type of active therapy and it heals wrong, where it's only 70% as strong or 70% as elastic, that's the lack of strength leads to re-injuries down the road. The lack of elasticity leads to more stiffness and rigidity in the joints, whether it's the back or the neck, whatever joint has been injured. And of course, the goal of the therapy is to stop that from happening. So the therapy that's so important in that remodel phase, not just physical medicine and specific stretching to increase the elasticity, but what we call active therapy. And that helps to align those collagen fibers to get it back to normal strength and decrease the likelihood of those nerves getting trapped in there. And when you get the right therapy for each of the three phases, that's when you can not only have decreased pain and discomfort and muscle spasms, which is very good, but just as importantly, that's when you can go all the way back to the full range of motion you had before the injury, and no stiffness, to where you can work fully, sleep, bathing, shower, cooking, cleaning, laundry. In other words, all these things that are important to do in life. That's what happens. That's how permanent injuries happen. Typically when you don't get the right therapy for the right phase of healing, specifically when you don't get physical medicine in the repair phase and the active therapy in the remodel phase. That's what causes permanent injuries. And of course, what we do in our goal is to use the proper therapies in each of the phases of healing to prevent all that from happening, to prevent the nerves from being sensitive, the nerves from being trapped in the scar tissue, to increase the strength of the scar, the strength of the scar tissue, and to increase the elasticity of the scar tissue. And that way, you not only are pain-free when you move and bend and twist, you don't have muscle spasms, you have full mobility with no restrictions, and now you can go, that's what takes you back to your pre-injury status, to where you can go back to working fully, bending, again, we'll say work fully with no pain or restrictions, sleep with no pain or restrictions, bathe or shower without stiffness and pain. See, those are the things that matter. That's what happens, and that's what we prevent. So that's what causes permanent injuries typically, and this is how we prevent permanent injuries. So again, we're Orange County Chiropractic Car Injury Clinics. We not only help prevent permanent injuries, we help decrease your pain, muscle spasms, increase your mobility so you can get back to enjoying life to your pre-injury status. That's what we do. That's how we help you. So give us a call. If you've been involved in an accident, it's covered 100%. Your coverage in our office is covered 100%. If not, let me offer you our new patient special. It's only $97. It typically is $350. It's $97. Let me share with you what it includes. It includes a private consultation with the doctor to make sure it's a problem we can help. It includes range of motion tests, so we know exactly which motion we need to focus on with our therapy to get that back to normal. It includes nerve tests, so we know exactly which nerves and which therapy to use on which nerves to decrease the pain and our muscle spasms. It includes muscle strength tests to see which muscles are in spasm or pain, so we know not what therapy to use to decrease that muscle spasm and what specific area. It includes joint tests, so we see if any joints are involved and where they're involved, so we know exactly what therapy to use for those joints. See, these tests are so important because they not only tell where the problem is, they tell what anatomy is involved. And it is very important to know that because there's different therapies, whether we're going to treat a muscle problem, a nerve problem, a range of motion problem, a muscle strength problem. You see, we have to know exactly which areas are injured or where there's problems to do the right therapy in the right area. Now, the new patient special does include 2 x-ray, a minimum of 2 x-rays, so we can see on the inside what we can't see on the outside. And when we see it's a problem that we can definitely help, it also includes 3 chiropractic treatments. So we will immediately start to work with you to get you to feel better fast, get you feeling where you can move pretty fast with less pain and discomfort. And it includes 3 pain relief muscle therapies for treatment. So in other words, when you find the problem, the new patient specialist is going to include the chiropractic, some 3 treatments and 3 therapies to immediately start to help relieve the pain and discomfort and increase your ability to move. Okay. Now, it does come with 2 guarantees. One is there's a 72-hour guarantee. If you're not 100% satisfied within 72 hours of your first visit, you get 100% of your money back, no questions asked. We are that confident we're going to be able to help you. Number 2 is we have what's called a 7-minute wait policy. We will treat you, when you schedule your appointment, you will see the doctor within 7 minutes of your scheduled appointment. That is unheard of in medical practices, but not ours. In other words, we're going to respect your time. And when you come in, it's only going to take about 20 to 30 minutes for your first visit. So you will not have to take off work. You can come in the morning, you can come in around lunch, you can come in the afternoon, because we open early, as early as 9 and close as late as 6. So you won't have to take off work. And we'll get you right in. So when you call, there's a real good chance we'll get you in that day. We won't make you wait, and it'll only take 20 or 30 minutes to go through all these systems to see exactly where we're at. That's what you get with our new patient special. We feel real confident we can help you. So this is how we prevent permanent problems. So I shared with you what typically causes permanent injuries, especially from car injuries and accidents and falls, things like that. But also the solution to not only decrease your pain, decrease your muscle spasms, increase your mobility so you can, work better, sleep better, dress, shower, and bathe with no pain or discomfort or restrictions. But what's just as important is decrease the likelihood of you having a permanent injury to some degree the rest of your life. That's exactly what we do. And we do it all day with a lot of patients. So give us a call. We're Orange County Chiropractic Car Injury Clinics. And again, if you're suffering with pain, back pain, neck pain, muscle spasms, pain, joint pain, arthritis, give us a call. Chances are we'll definitely be able to help you, and we'll be able to help you typically real fast and typically on the very first day. We'll know what's going on, and we'll be able to start helping you immediately. Give us a call. We're at 714-617-5858. That's 714-617-5858. pick up the phone. Chances are we'll get you in the very day you call. Worst case scenario, the very next day. We look forward to helping you. Give us a call.